so important that little children grow up healthy. A good healthy start to life sets them up for a healthy future. Hello, I'm Carla Grant. For Aboriginal and Torres Strait Islander kids, it can be harder for them to get this good start. Some of the problems they face start right back before they're even born.
We have issues with the very early beginnings of life, so low birth weight babies, failure to thrive issues, recurrent infectious diseases, which in many instances are wholly preventable. So that in itself starts the children sort of behind the eight ball, and there's a lot of catch-up.
A lot of young mothers. There's really lots and lots of young mothers in the land. And I think some of those mothers have a weak family, not a strong family.
Most of them live in quite stressful situations, very high rates of smoking, alcohol use, so those are different as well. 60% of these women are smokers, quite heavy smokers, and there's quite a lot of heavy drinkers as well.
And so the kind of good antenatal care these women need has to be very broad. Across the Northern Territory and Queensland, there's been a very successful program running for a number of years now. It's called Strong Women, Strong Babies, Strong Culture. The program takes a long-term approach to pregnancy and birth by combining traditional and Western culture and knowledge to educate young mothers and young girls.
Here we have good, strong food. We need energy foods. Energy foods are wheat bix, bread, rice.
It starts right back in primary school to better educate young women about cultural ways and women's business.
And having strong babies is preventing babies from being born too small in some communities. 1 in 5
Now the program is delivered by Aboriginal women for Aboriginal women. Ladies that work on the community identified strong women workers. Now those ladies are not qualified health workers, but they are experienced ladies and qualified in cultural beliefs. And we get involved in growth assessment, where we work very much in the baby clinic and talking to mums. School screening, we get involved in school screening, and a whole lot of us go out, we all go out together and they do more like a little health week or something. So all that information is given to post-primary girls at school. So when they're old enough to become mothers, then they have that knowledge.
This mother here probably have done the right thing by eating the right food, looking after her health, and taking her tablets every day, and not smoking, not drinking.
Alcohol use in pregnancy and childbirth, if mother could have miscarry, she could miscarry early, and there is a big problem with baby being born with fetal alcohol syndrome.
5 out of 10 pregnant Aboriginal women also smoke.
Cigarette smoking is a great big problem in communities. When we've had any miscarriages, and the first thing I asked about was the mother a smoker, and they say very big smoker, so I look for that.
And the baby can grow strong too.
There is a lack of understanding of what's good and what's not good for them, and the access to the foods containing lots of folate, like the greens and other foods. We stress from the start that, and talk to them about breastfeeding is more hygienic and more safe and affordable, and we tell them, that it's the best thing for babies when babies are born.
So that's why the skinny mothers are having the skinny babies. You could see the difference there.
The Strong Women program is a very successful program, and full credit goes to the ladies that work in the communities, because I think they work very hard. I'd like to see them in every community. I'd like to see Strong Women program everywhere.
and we can stop all this.
To an Aboriginal person, health is not just about being well, it's also about the health and well-being of their family and community. So when we're talking about the beginnings of life, this understanding needs to be incorporated into any program for mums and babies.
The standard in Australia is 14 visits per pregnancy, and the average here was 3, so that you can see that they just weren't coming in. And this contributes in part to very high rates of preterm birth, low birth weight babies and babies that die either at birth or stillbirths.
And maternal health issues are not specific to rural and remote communities. They're not. Our health status, unfortunately, is basically the same whether you're looking at a remote community or in an urban setting.
Morning, Stace. How are you?
Thank you. How are you?
Good. I'll just get you to do your urine specimen.
Yeah.
Have you had any burning or stinging or any problems with your wee?
No.
Okay, darling. Will you just go and do a midstream speci for me? Have you got your yellow card?
No, misplaced.
Have you still got it at home, or
No, I don't think so. I've looked everywhere.
so I'll have to do a new one.
Yeah.
Okay.
Okay then.
All right then. Will you go and do that?
Always.
In Mount Druitt in Sydney's outer western suburbs, Darrick Aboriginal Medical Service is a great success story. They have been offering family-focused pregnancy care for 14 years.
Aboriginal women weren't presenting at the hospital for antenatal care, and that when they did present and had problems and were admitted to hospital, they weren't actually staying in hospital. They would abscond, they disappear, and then they were hard to follow up in the community. And all these things led to poor outcomes for the mothers and the babies. We've got women that need housing, that have got drug and alcohol issues, that their children might not be attending school and they can't come for an antenatal appointment because they've got Department of Housing coming to do an inspection. So in order to give good antenatal care, we have to tackle all those other problems as well and support them in their whole lifestyle. Well, that looks good, no problems there. 13th of June.
What Carol and I did, she taught me all about her job. It's been enrolled with the midwife, and I taught her all about Aboriginal community and how to track them down and win them over, you know, to feel comfortable with her. In the labour ward itself, we did a lot of support in labour with the girls. We'd say to them, look, we will be there. You know, we'll be there with you, because they'd, you know, get real sort of shy about going up to the hospital. And we encouraged family members, and we educated the hospital how important it was to have family members there. Because so look, we're talking about an Aboriginal family here, you know, which is a big extended family.
If they didn't come on the designated day, then we would go and see them, make another appointment, and we just persevered. When did you have your ultrasound, Stacey? On Tuesday.
Tuesday, I'm pretty sure it was.
Okay. Was that good?
Yeah, it was.
Got to see the baby?
Yeah, just moving around and stuff. I was going to find the sex out, but it wasn't in the right position.
Hiding.
Yeah.
Didn't want you to know, Stace.
So I decided
This sort of program doesn't have the good results if it's run from hospital services, because the community don't trust them. And there's also those really strict guidelines within the hospital, and we're more flexible.
if I eat, then I'm fine in the morning because I've got something in my stomach.
Most of their needs can probably be met through us. Their needs for social support, their needs for other services, counselling, children's medical and counselling services, support with partners maybe in jail, or all sorts of things. That anything we're able to sort of find the resources within Darrick or within the community for them.
Well, there, I can hear it. Aboriginal people don't trust services because they're set up and they don't last very long, or the staff doesn't last very long. We've been here a long time now, 14 going on 15 years.
Some of the mothers that were that we looked after in their pregnancies, their daughters are having babies now, and they say, you get down there to Carol. You get down to Derek to the antenatal program. Carol will look after you.
Any problems?
No problem.
All right.
Thank you very much.
Okay, Stace, I'll see you next time. Bye.
There are lots of barriers for Aboriginal people to access appropriate health services, things like social and geographical isolation or just being poor. It can also be hard for them to find a health service that's culturally appropriate. And not all health services are located in or close to a community. This can be a real disincentive to seeking health care.
I don't know how you would feel if you were living in say you were living in Canberra itself and they didn't have a service there and you had to go and move to Melbourne to access a specific service, giving up your family, having to live in a hostel where you can't have family come and stay, not being able to take your partner or your children with you. I don't know how you would feel, but I certainly would feel that, I would run away and go home sometimes too,
In Alice Springs, Alucra Birthing Centre was founded over 20 years ago by the Grandmother's Law. It's a birthing centre that enables Aboriginal women who are at low risk of complications to have their babies in a culturally safe environment.
At the time, the only birthing service that was available in Central Australia was the hospital. For Aboriginal women, that really went against traditional Aboriginal women's law in relation to birthing, and women felt that this didn't meet their needs and felt offended by the fact that male doctors were delivering their babies. So the women themselves decided what Alucra should look like, where it should be located and how Alucra should be shaped. We have a no male policy, so it's a place where women actually feel safe and comfortable to come. We have our birth centre on our ground, so those who meet our low risk criteria are able to birth at Alucra.
Alucra has also negotiated a special relationship with the main Alice Springs Hospital, which allows a mother who might be at higher risk to be admitted as a public patient with her own midwife from Alucra, a great way of providing continuity of care.
Raylene, hello, how are you? Good. Been feeling okay this
Aboriginal
week?
women coming through the Alucra are more complex than non-Aboriginal women. There's more social problems, literacy, language problems, could be a second or third language of English.
Okay then, well, you ready to come in?
Yes.
Okay.
So we're doing quite complicated procedures with women, doing blood pressure checks and taking blood, and so, they're not sort of used to so much medical intervention perhaps as non-Indigenous women. Going to a stranger is a normal thing for a non-Indigenous woman to do. Going to a stranger for an Indigenous woman, that's a bit more complicated for her.
The model of care that we deliver here, we've designed ourselves, but it's based on evidence-based best practice around the world. And it means that, basically what we're doing is sort of leading edge stuff in maternity care.
It has been successful over a period of 20 years of building the sort of relationship that you need to build with the community, such that close to 100% of all pregnant women in Alice Springs attend Alucra for antenatal care. Now we know that if you present for antenatal care early and you receive antenatal care regularly and you're well supported during your pregnancy, that has an impact on birth weight, and we think that the improvement in birth weight in Alice Springs is likely to be associated with the high quality of antenatal care.
He's pushing against it.
The majority of our babies are not low birth weight. Breastfeeding, we have fantastic rates of breastfeeding in our communities. In some communities, maybe wholly due to the Strong Women, Strong Babies program. So they breastfeed, they're plump, they're gorgeous little chocolate babies. But then come time for weaning, and so we find that their weight actually, it either plateaus or it begins to drop, and so they have failure to thrive. And it's often very difficult to sort of pinpoint either when they started going downhill or where we can appropriately intervene to then help these kids pick back up again. Addressing the failure to thrive, we don't just need to be treating the baby, we also need to be making sure we have enough social and parental supports in place to make sure that happens.
Aboriginal mothers and their babies are finding support from programs around the country. In Central Australia, there's one women's council that has set up a very effective nutrition program.
Women Council is a big organisation for Yankunjara, Pichinjara, Ngajara lands. We got these different age programs, like for domestics and disability advocates and projects in Women Council. It's sort of like a big umbrella, and I work for nutrition.
The nutrition project looks at a lot of areas. We look at health promotion and nutrition education. So we work with mothers and young families to teach the children about nutrition and good food.
Yeah, I've got this little 2-year-old boy, my son. It was very hard. I had to, when he was born, we had to fly to Adelaide. And he was a sick boy. He had a little colostomy bag for 6 months. So I took her to the lands, to the community with the colostomy bag. And I was managing all that. And I see that I done good job to my son. And I look back to my community and I see all those young mothers. They need real good help from us, you know. Also, we do workshops in the communities, in childcare, invite all the mothers and the kids and help them talk strongly to the mothers to be a strong mother in the future.
And we teach the mums about introducing solid foods. So when babies are really young, and when the mothers need a lot of help and a lot of education in learning about what's good food and how important this food is to grow children and to make children strong.
We show them a lot of good things, take them to the shop, show them what to get for the babies.
There's lots of services in town to support the kids, but then there's not enough services or not enough outreach services that go out to the communities and support families in a holistic way. And that's what we try to provide in our program.
When somebody comes, I'm there, standing to help people. With Michelle as a Jungo team, Marlborough team.
The Townsville Aboriginal and Islander Health Service, or Tarz as it's known, has developed a great clinic that started off providing only pregnancy care. Over the years, it's grown to also provide family care, and one of the keys to its success is that it's combined many health services under the one roof. Tarz is a very busy and popular clinic.
And the first year that we started, we had 40 pregnant women, and now we see over 200 pregnant women a year, so it's really grown. We also intended at the start to concentrate on pregnancy care, but these pregnant women always turn up with children, and so it's very much evolved into family care, and we look after anyone in that childbearing age.
We do antenatal, postnatal care, percentile charting for the children, immunisation, hearing screening, just general education, one-on-one antenatal education.
I mean, it's like a one-stop shop, and the whole medical centre is very much dedicated to this program. So, and it helps; it makes a big difference. Yeah.
Yeah, you need to be very flexible when dealing with our clients, and we need to do everything or a lot of things opportunistically while we've got them here. So we try and get everything done when we've got them. Any that heavy feeling or any pain at the moment?
So if you pick out the important bits of the care, you make sure you get those done, then you're going to, you covered what is necessary for a good pregnancy outcome.
That's good. And plenty of movement?
Yeah.
Lovely. Okay, that's all I needed for now, Sarah. Thank you for that.
Okay, thanks.
See ya.
It's been one dream of mine to work with my own people, and I'm very proud to be here, and I want to be here. You really need to want to be here to help the community.
So it's all comes together, and it gives a culturally appropriate, safe environment. And Garbutt is a real low socio-economic area, and we've been around for 30 years, and I think, we've reached a point, we know what the community wants because we're all Aboriginal and Torres Strait Islander people. So, and I think one of the key things is giving the community a sense of ownership to this program.
Here I know most Indigenous people are a bit embarrassed, a bit ashamed. If we were going to a mainstream surgery, we'd be pretty ashamed and we wouldn't want to make eye contact with no one.
Just with the mainstream, I sort of feel more uncomfortable there because you don't want to look or anything, don't talk to people because you might rub them up the wrong way. Yeah. Because whereas here, it's sort of like a gossip when we come here. Just everyone catches up as on gossip's going around.
Like what we've done is really focused on this program having a sense of wellness and happiness and healthiness. Whereas over in the main clinic, people come in because they're not well. And I think that's sort of one of the success of this whole program is that sense of wellness. So the standard of care and the standard of service delivery here is at the same standard if you went to a white middle class clinic. The only difference is you're not going to fit in that environment.
It is, yes, a style of medicine that once people have tried it once, it gets around in the non-Indigenous community by word of mouth just the same as it does as Indigenous. And so, yeah, exactly, it would work. It works for anyone.
We're producing healthy babies in this community, and you couldn't ask for anything more. And we're probably providing the best maternal health care for children in this community. Right across, that's black or white.
There's some fantastic work being done out there in communities to improve the health of Aboriginal mums and babies. And one of the reasons there is success is because the programs take into account the complexities of Aboriginal health.
By 1994, the birth weight of Aboriginal children in Alice Springs was as good as the birth weight of non-Aboriginal children. The infant mortality rates have fallen from 120 deaths per 1,000 live births down to around 14 deaths per 1,000 live births now, so we're talking about a tenfold decline.
We've demonstrated, and so have other clinics. There's one over in Northern Territory. I know Durrick down in New South Wales, Woononga in Canberra. They're doing some brilliant work down there as well. It's just about, sort of getting a similar model right across the country. I think we'd make a big difference and we'll have healthier babies like my grandchildren here.